Adams, the CEO of UICC, and it's an absolute delight today to introduce a good friend of mine, Rifat Atun, who I think I've worked on and off with for most of my career in global health, for about 10 years. We certainly came across each other early because everyone comes across Rifat because he is everywhere affecting the thinking of the community about cancer and global health. Rifat, welcome and thank you very much for doing this conversation. Thank you,
Cary. It's a pleasure to see you again, virtually.
Now, I'm not too sure that everyone is aware of how influential you are in the world. I got a quote here, which I've taken from your bio, which I thought was fantastic. It said, you are recognized by the Web of Science as one of the world's highly cited researchers. And I know you have had hundreds of publications, but tell me, what was your journey like to become such an acclaimed researcher in the field of global health? Where did that come from?
Yes, it was... It's been an interesting journey and a very rewarding one. It's been an immense privilege to work in global health for almost 30 years now. And really, I got into it by accident, I would say. After I had finished my clinical training, I decided to do an MBA while I was doing my postgraduate training, and that exposed me to strategy and health systems, which I really liked. And then I started undertaking assignments, initially starting in Chile, in Latin America. And then before I knew, I had projects and engagements in more than 10, 15 countries. And so while I practiced clinical medicine and worked in academia, I decided to pivot into health systems work and have been working around the world since early 1990s. And I had the opportunity to work in the post-Soviet context when the Soviet Union broke up. So there was an opportunity to really look at big health system reform issues. And then I spent 3.5 years as a member of the executive management team at the Global Fund. And that was an incredible experience and learning, where we oversaw investments in 140 or so countries around the world to address big challenges in global health. So it's a journey that has evolved over time and has exposed me to many, many different settings and incredible people around the world.
Well, I would agree with you. I mean, I'm glad to hear you've got an MBA. In fact, that was a bit of a surprise. I didn't know you. You and I are one of the few in the world, if there's health, that maybe have an MBA. But I agree with you. It's a wonderful way to learn around how business works, strategy, planning, execution. And I guess at the heart of it is making things happen, which I would say it's one of the things I've always admired about your approach. And we've worked together on several projects where you are intent on not just doing the research, making sure that there's research with a purpose. And the purpose is to improve health systems generally. And that's the way I've been involved with you. So would you say that is a core philosophy that you have, which drives your research? And it's not just research for publication's sake. There's always a sense of it must have an impact. And I've seen that many times, yeah?
Absolutely. I think our role as researchers and mission of universities such as mine at Harvard is really to use research and knowledge, generate new knowledge to improve societal well-being. And this is what we're here for. It is important to the research to question the status quo and to understand phenomena and also to develop new policies. But policies are only as good as their execution. If they're executed and they're able to have impact, and this is when we realize the benefits. And similarly, research for the sake of research is not. It is important, but not. It is essential, but not enough. Research must be translated into policy, which must be translated into action to benefit the society, especially the most vulnerable people in our society.
And that's really been brought to life, I think, in the recent work that we've been involved with, which is in Latin America, where you've taken a lead working with UICC, Eduardo Cazap from SLACOM and others, with the support of Novartis, looking at the health system's challenges for cancer treatment and care in a number of countries. Now, that work's nearing completion in terms of the research, and we're already seeing it's moving into now policy discussions. So what have been the highlights of that work for you?
Well, I think the most important highlight is to have the opportunity to work with so many committed colleagues, incredible colleagues from Argentina, from Brazil, from Chile. That's very special for me, and Colombia, and of course beyond that. And there was I think what was so unique about the ICCI LA project, the Integrated Care Control in Latin America, was the sort of multidisciplinary perspective we were able to bring, including civil society and the patient groups, leading clinicians, policymakers, to really look at taking a step back and honestly looking at what the issues are. Many of these issues did exist, but what COVID did was to really expose them and to augment them, and in many cases multiply sort of the challenges. So we're able to look at sort of taking a health systems lens, which I think is critically important, because the systems need to be fixed if we're going to improve outcomes. So we took a systems lens to look at what are the barriers and enablers to improving cancer care, because the evidence is there. We know what to do. The question is, how can we get the evidence into practice? First, generating the right policies, and secondly, translating these policies into action to ensure that they lead to improvements in access to healthcare, access to services, and help to improve outcomes in an equitable way, while using resources in an effective and efficient way that is responsive to user needs. So we were able to have a really honest look at the issues through initially a survey and a series of roundtables, really open, no holds barred discussions under Chatham House rule to discuss these issues honestly and come up with a number of suggestions and priorities on what could be done, sort of the potential policy options that could be explored by or weighed by policymakers to implement in the countries.
I think one of the things which I've admired is that you're able, through your research, to instill sort of like some grit and energy behind the advocates. They're working with evidence, they're working with good, solid data. And certainly in the countries which are able to convert your great research with the energy that you give them, I'm hopeful that we can see policy change. And that's something that you seem to do quite well. You inspire people with the information that you provide them, because a lot of people provide information, but it's not necessarily inspirational. Is this something that you're keen on, that the information should be inspirational?
Absolutely. Information, the research should matter to people. And it is important that we frame research in that sense, to say, what are the implications of the findings for people? What are the implications, for example, the improving equity, enhancing well-being of individuals, and addressing the challenges that individuals face in accessing care and accessing so many innovations that we have. And we should be able to achieve that in the 21st century. But there are many barriers. So we try and highlight what these issues are, but provide a strong sense of what can be done and what is possible and what the potential benefits are. And changing the mindset from talking about problems all the time, but actually saying, look, problems do exist, but they're there to be solved. So what kind of solutions can we bring to bear to them to demonstrate that there are massive benefits to investing in health to address these challenges, and provide a calculus on what the cost of investment might be, but what the benefits might be, which all too often far outweigh the cost. So you make a compelling case for investing in health, not just to ministers of health, but also ministers of finance, ministers of economy, prime ministers, so on and so forth.
Well, well, I agree with completely. I think, the financial aspects of making the case for action, we sometimes miss out on, and we need to improve on generally. Let me talk about another part of your life, which is, it seems to me that you must be one of the leading commissioners on Lancet Commissions going back the last 10, 15 years. I've lost count of how many you've been involved with. It must be 13, 14, but it's something which you obviously take very seriously. And again, I guess, given my understanding of you, you do it because you believe it can make change happen. So tell me about the commissioner process. How does that happen? And what highlights have you had in terms of some of the reports that you've been involved with?
Yeah, commissions are really great ways of bringing together really committed people to look at major issues. And I think Lancet and the Lancet family of journals ought to be commended for what they're doing, and the editors who are involved in this process, because they can take as long as 4-5 years sometimes. So it's a lot of effort in thinking about designing the commission, but also doing the research and then publishing it. But that's just the beginning. It's actually what happens afterwards. So with the process, very important to have a multidisciplinary and inclusive group, ensure that it is diverse, and so that the problems are looked at from multiple lenses. And then it's an opportunity to review sort of the current literature, but also very importantly, generate new evidence that can be used to influence policy. But not just policy options, demonstrating the value of implementing these policies. Because in real life, policymakers have hard decisions to make. Resources are constrained, so they're always competing demands on the resources. So when laying out policy options, one should be able to demonstrate that investing in a particular policy may cost X, but will lead to benefits in terms of health, which in itself is critically important, but also will lead to improvements in social well-being of the society, and also generate economic returns and contribute to economic growth, which is important for sustainability. So I think commissions have an opportunity to bring together the best thinking and the state-of-the-art research to address these problems and to provide policymakers the evidence they need to make important decisions.
Yeah, and I think, we have to accept that, there are a range of challenges that policymakers have to address, but it's important that we show them why a particular issue is important in itself. One of those commissions, I think, is on childhood cancer, and this is a month when we have a spotlight on childhood cancer. And I think, obviously, you were heavily involved again. What do you think, what did the commission what's it's produced that's really informative or worthy of note from the work on childhood cancer?
Yeah, and that was a really super commission with many committed colleagues, and I had the privilege of being the co-chair of that commission. And I think the important contributions of that particular commission was, first of all, it re-examined the incidence of childhood cancer. Through novel modeling approaches, we're able to demonstrate that 1 in 2 cases of childhood cancer globally are missed. There are huge inequities currently that exist, but many children don't even have the chance to enter the health system, or when they do, they are not diagnosed. So that was one important finding. So actually the numbers of children with childhood cancer is actually far higher than what we currently think. Now, of course, this has major policy implications because resources need to be allocated appropriately to meet that demand, to meet the need and potential demand. Secondly, what we're able to demonstrate was that there are a number of interventions, when implemented alone or in combination, for example, treatment, scaling up diagnosis, and strengthening health system and the quality, can yield very substantial benefits. And the benefits are huge. So for every $1 invested, there's a $3 return. So this is very attractive and a compelling case for countries to think about investing in childhood cancer. And we're able to demonstrate this for each region of the world, for countries, and by countries, by country income groups, and also lay out what could be done and what the different combinations of interventions might be at different levels of scale up.
Well, I'm sure it'll make a difference. I mean, certainly when these commissions report, the UIC family, pick them up, celebrate them and share them and see how we can use them country by country. There's a new one, which has just been announced, which is Cancer and Health Systems, which are being led by our good friends Felicia Knoll and Mary Gospodarovich, I think. And I'm assuming that you're involved with that.
Absolutely.
And it's certainly right in your space on health systems. So What are your ambitions and hopes for that actual commission? And when do you think it would report? I mean, it seems like a large subject to report on. So what are your views?
Yes, I think many of the earlier commissions, such as the Lancet Oncology Commission on Radiotherapy, that involved Mary Gospodarovich, but also David Jeffrey, which we had the opportunity to co-lead. That showed the benefits of, scaling up interventions such as radiotherapy and to dispel myths that this is costly or complicated or complex. And this has been picked up with a lot of energy by IAEA, I might say, to try and develop programs in countries. But as with the Childhood Cancer Commission and the Radiotherapy Commission, and subsequently the Lancet Commission on Imaging Diagnostics for Cancer, all pointed out the importance of health systems. So technology is important, as are other inputs such as human resources. But if the systems do not function, we're not going to get the outcomes. And when these interventions, such as diagnostics and treatments, and radiotherapy, surgery, and chemotherapy, are combined with improvements in health system, we see massive synergies and great improvement in outcomes. So health systems need to be fixed in order to realize the benefits of these innovative technologies that are coming to the fore. So this, again, very early days with this commission. We're still discussing on what we'll be doing. But we'll look at how in different parts of the world health systems can be strengthened or transformed in some settings to ensure earlier adoption of these innovations and scale them up to ensure that they reach those who are in need, to enhance outcomes, to improve effectiveness of the care provided, improve efficiency of the care provided, very importantly, improve the equitable access and outcomes, and also ensure that the services are responsive to users' needs. Because one of the important findings of the Lancet Palliative Care Commission, which I was involved with which Felicia so ably led, was that services are not designed to provide the right kind of dignity that people need, for example, for palliative care. So that's also an important consideration, to put a human face to all of this. So design systems that are person-centered.
Well, it's coming at a good time. I think we've all experienced the COVID challenge to health systems, which has revealed significant challenges, efficiency, effectiveness, and we know that cancer itself and cancer patients have to some extent suffered as a result of the focus on the COVID challenge and the pandemic. So I think the report, when it comes out, hopefully will reinforce the messages that we're currently saying about the health systems generally need to be reinforced, and they need to be strengthened and supportive for what the future of NCDs, which, as we know, is the challenge that we all face over the coming years. Rifat, we're going to come to an end there. I read with interest Felicia Knoll's note about this new commission, and there was a line that she used, which is called, we're going to look at it, I think, through the optic of the economics of hope. And yes. I share that optimism. I think that there is an opportunity, and I'm delighted that you and the team are getting back together to look at the health systems challenge. Certainly, we are facing a decade where we do really need to reinvest into the health systems to hit the SDGs and many other NCD targets that have been set out. And with you there driving it forward, I feel confident. So thank you very much for your time today. Pleasure talking to you, and I'll catch up with you soon with another meeting about Latin America, no doubt.
Yeah, thank you, Cary. Maybe just to finish. So I think very important to invest in health. So investing in health and health systems is a smart investment. That leads to substantial health returns, but also huge societal gains and economic returns that are critical for sustainable development. So I think that's the key message we need to give to policymakers.
Right. Well, we'll make sure that gets them straight away. Rifat, a pleasure. Have a lovely day.
Likewise. You too. Thank you.